So we did this treatment just like this, very, very small force. And so I'm going to test the vertical spring now. And that feels better because the force goes through that joint and then goes beyond it to your neck. Okay? Let me have you walk down the hall and back and then come sit in the chair and tell us how you feel.
Okay. I feel like I'm 20 years younger. I just feel so less tense.
Okay.
And
Okay.
I guess I was more tense here than I thought.
All right.
I mean, that probably translate into all the other parts of the body.
You know, it is interesting because sometimes when I treat someone's jaw, they do report kind of a whole body stress relief.
It does, because I've always had issues with the jaw. Because I had braces for 5 years.
Sure. Wow.
Yeah.
Wow.
And I had neck pain for a long time, and then when I got the braces and the retainer,
yeah,
it all went away. But it took about 5 years to get it all.
Wow. Interesting. And you know, we know that stress can enhance TMJ pain, but you know, there's limited effect. I think you could do a lot of biofeedback and a lot of internal jaw work, and I just don't think it would be effective. You know, sometimes the stress is driven by the injury. You know, if there's a trauma that caused it to be compressed or whatever, that's facilitating stress, right? And when you restore normal joint function, then the nervous system really quiets down. The cause of the stress can be released. And I think that's not really well appreciated. I think there's too much of blaming TMJD on stress and going the stress route, as opposed to it may be related to stress and to something mechanical. Treating the stress approach doesn't correct the mechanical, and the mechanical itself is going to cause stress. So I'm a big fan of keep it simple, treat the mechanical stuff first, see how the person does, because usually it's a one-time treatment. It lasts. The body, if you treat it very gently, the body readjusts, reclaims its function. So you're not going to have to see me again for this.
Good.
Okay?
Yeah.
I'm going to teach you how to treat it yourself.
Oh, really?
And, you know, you're in a stressful job, so maybe once a week you lay on your back, roll up a towel and put it under your neck so you arch back a little bit. Let your mouth open just slightly, separate your teeth, completely relax. Come in front of the earlobe, okay? Capture the jaw and just real gently pull it down and then hold that for 2 minutes.
Okay.
Okay? That's the self-treatment for that. And, you know, if you find stress needs to be managed, then you chase the stress route, which would be more effective now because now the mechanical contribution to stress, nociception, pain is improved. Thank you.